What's up, everybody? Maddie Wills checking in with another episode of BeWell with Maddie Wills, of course, brought to you by the fine folks over at MetroHealth, where we have a different conversation about well-being, physical health, mental health, and all of the above. And today we are with my friend, Dr. Yan Sun, who's going to tell you a little bit about cholesterol, the different types of cholesterol, why it's important for you to maintain a healthy lifestyle as it pertains to cholesterol and everything in regard to that. But before we get to that part of the conversation, why don't you just tell everybody, Dr. Sun, a little bit about you, your journey into MetroHealth, and what exactly you do here?
Thanks, Maddie. So I joined MetroHealth in 2023, and I have been working here for 2 years as an internal medicine doctor. And today I'm so happy to be here to share the information about cholesterol.
Well, we really appreciate you taking some time out of your busy days. One thing that we do know and I appreciate is that you guys are extremely busy. You all went to school for a million years and you have busy calendars and all of that. So we really appreciate you, taking a few minutes for us. But without further ado, we'll kind of hop into this cholesterol conversation, okay?
Sure.
So I think the most obvious and probably pertinent question to kick things off is, what is cholesterol? What are the different types of cholesterol in our bodies? And what is a lipid panel?
That's a very good starting question. So what is cholesterol? Actually, cholesterol, known as lipid, which is a very important substance in our body. It's kind of a waxy, fat-like substance, and you can find in our blood and cells. So when people go to see doctor, usually the doctor will order lipid panel, so which include the cholesterol. And cholesterol have several types. The first is LDL, low density lipoprotein, which we call this bad cholesterol. Means that it's not good for your health. Another type of cholesterol is HDL, high density lipoprotein. Usually we call this good cholesterol. Means that it's good for your health, and usually it can help you remove the LDL from your body. So when you look at your lipid panel, you can see another name called triglyceride. Actually, triglyceride is not cholesterol, but it's another type of lipid. So usually when we check the lipid panel, we will check both triglyceride and cholesterol together. And usually in your lipid panel, we will see another number is total cholesterol, which include LDL, HDL, and a small amount of triglyceride. And both triglyceride, cholesterol will be transported in your body by the lipid protein. And if you can see the high LDL, high triglyceride, and the low HDL, it can cause the plaque build up in your arteries, which increase the risk of health conditions like stroke, heart attack, and vascular disease.
So I do have more questions about the good versus the bad cholesterol, but in your estimation, how early and often should we have our cholesterol levels checked?
Sure, that's a very good question. So usually MetroHealth recommend all children before their puberty at age of 9 to 11 years old, and after puberty at a year of 17 to 21 years old, all kids should have a one-time lipid panel screening test. For young adult, if you never had any lipid panel screening as a child, usually you should get your baseline lipid panel check at the first time you go to see your primary care doctor. In the future, how often and when you're going to follow up your lipid panel, it really depends on risk factors. Like if you have hypertension, diabetes, smoking cigarettes, or family history of premature coronary artery disease. So if you do have a moderate to high risk, and then usually you should follow up your lipid panel in male around 25 to 30 years old, and in female around 30 to 35 years old. And usually you should repeat every 1 to 2 years.
Okay.
But if you don't have any risk factor, your risk is very low, you can start follow up your lipid panel in male at a year of 35 years old and female at age of 45 years old. And usually you can repeat every 4 to 6 years.
Oh, wow.
Yeah.
So you don't have, so what you're saying though, if you're at low risk, then you don't necessarily need to check it every year.
Exactly.
More like 4 to 6 years.
Exactly.
Okay. But it is important, obviously, to get that initial
The initial
diagnosis.
screening is very important.
Gotcha. And that's a common theme with any of the doctors that I've spoken with. No matter what we're talking about, it always seems like, check. You might want to check first and not wait until you're, a lot of my friends 40 years old or whatnot before you just start looking for the first time, but get the initial diagnosis done so that you can know where you are and then kind of go from there.
Exactly. And also you need to know that the risk factor change, right?
Yeah.
You might be very healthy at your 30 years old, 35 years old, but you might have hypertension, diabetes at 40 years old. So you should more frequently screen your lipid panel.
Right. Makes sense. All right. So what factors can contribute to high LDL levels and what effects can they have on our bodies?
So many factors can contribute to high LDL and low HDL. The first is poor diet. And you know there's a bad fat, right? It's like saturated fat, trans fat, they're all bad fat, such as the animal products, fried food, baked food, processed food. They're all bad fat, which can cause your high cholesterol level. And also another factors like smoking cigarettes, physical inactivity, stress. I want to mention stress is because stress usually can change your hormones and cause the cholesterol level change. And also your underlying health condition like obesity, hypertension, chronic kidney disease. And also, lastly, I want to mention the factor is genetic. And there's some people, they have inherited gene mutation, which can prevent your body from removing the LDL. And sometimes can cause the health condition we call family hyperlipidemia. So sometimes can cause dangerously high LDL level and high triglyceride levels.
So for me, I know that when you think about high cholesterol, I often think about the food association with that, but you definitely laid it out. Genetics obviously plays a huge role in that.
Exactly.
And then just the level of physical activity and just like overall physical health also plays a big role in that. And then the one that I didn't think about, maybe just because less people smoke cigarettes nowadays, but cigarette smoke definitely will contribute to bad cholesterol, huh?
Exactly. So that's why we should quit smoking cigarettes.
That is another reason why we should quit smoking cigarettes. What are some simple diet and lifestyle changes that we can make to maintain a healthy cholesterol level?
Sure. So first of all, just now we mentioned the poor diet, the bad fat, but we do have a healthy, good fat, like the fish, seafood, avocado, olive oil, some nuts. That's all very good, healthy fat. So you should avoid the bad fat and keep on the good fat.
Yeah.
And then just now we mentioned like the stress, smoking cigarettes. So you should just try to quit smoking cigarettes and try to reduce the stress. And then for your underlying health condition, of course, you need to go to see your doctor and try to manage your health condition and control your blood pressure and your heart disease. And then lastly, I want to mention is the physical activity. So why is so important? That's because when you exercise, actually your body can produce lipoprotein, which is enzyme, can help your body remove the LDL. So that's why exercise is so important.
Oh, wow.
And then usually we recommend people should do exercise every week, like about 150 minutes, moderate intensive exercise. To be careful, it's moderate intensive.
Right.
Or you can do every week like 70 minutes of rigorous intensive exercise. So if you like do all of this lifestyle change, I believe that's gonna be significantly help you control cholesterol level.
So when you say you got a diagnosis that your bad cholesterol was too high, and then you do undergo a change in lifestyle in terms of your physical activity and you change your diet, I'm sure it depends on the person, but how long would a doctor such as yourself be looking before you would expect to see some real change in cholesterol levels?
Well, there's no exactly how long you should check. It
Right.
really depends how high is your cholesterol level. So sometimes if your cholesterol, like bad cholesterol is very high triglyceride, usually your doctor may ask you to check every three months. But usually every 6 months, every year should be enough to monitoring your cholesterol level.
And then there's the only way to check it is to just come get blood work done?
Exactly.
Yeah. Okay. Well, another strong set of reasons why you should have a very healthy relationship with your doctor so that you know exactly what's going on in your body. So
Exactly.
we appreciate it.
Thank you.
Thank you. So if you need to schedule a wellness visit that includes a cholesterol check, then you can schedule an appointment with your primary care provider through MyChart online at metrohealth.org/appointments, or you can call the number 216-MY-METRO. Again, that's 216-696-3876. I'm Matty Wills. That is Dr. Sun. Thank you so much for your time.
Thank you. you so much for inviting me here.
Absolutely. Perfect.